I'd like to open the City of Franklin Board of Health meeting, December 12th, 2022. Call this to order. And at this time, the roll call, everybody's here except for Dr. Golden, and we are still short two members. I need approval of the minutes from June.
So move.
I'll second.
Okay, any discussion? Hearing none, we will call for a vote for approval of the minutes from June 13th, 2022. All in favor, say aye.
Aye.
Okay, there's no comment period. I don't believe there's any unfinished business, so we're going to go right into new business and the administrative report and personnel updates.
Wonderful. Well, thank you all for being here again. And I wanted to touch base on where our current personnel is within the Franklin Health Department, because when we met in June, we were looking to fill those vacancies that we had. So since we last met in August, we hired a public health nurse, Jamie Capera. She has been working with us since about the second week of August and settling in nicely. And we have Megan Conway, who is our Drug-Free Community Coalition coordinator with Volition. So she's already hit the ground running and led a lot of their meetings, which, Mike, I'm sure you've worked closely with her as well. So Ellen Henry is our public health specialist, who's still working closely with Megan as they transition the program leadership. And Jamie is focusing a lot on communicable disease follow-ups, some work with our immune program. She has been trained as a car seat technician since starting with us, so she's really been active a lot, and we're really excited to have both of them on board. We have off-boarded or sunset both of our remaining contact tracers in October. So the funding stream that they were funded under, we weren't sure if it was going to extend beyond the October 31st deadline. So we had slowly started to wean down what they were offering our department. One of them stopped mid-August, and then the other one went minimal hours until the end of stopped till the end of October. The transition has gone well. Since ending our work with those contact tracers, our staff have taken on doing the work of calling positive COVID cases for under 18 or over 55. So it's been going fairly steady, but not. We average about 10 a day as of right now that fit into that criteria. So still tracking all of that data internally and keeping an eye on things. I'll just leave it at that for the COVID update. But then,
Question.
yep.
Where do the contacts come from that the tracers follow up on?
We call them contact tracers still. It's a term that we used early on in the pandemic, but that would be someone who's COVID positive through a lab confirmed test.
Not at-home testing.
Correct. And we would call that person. Originally, early on in the pandemic, we would have the list of individuals who they had close contact with, so within 6 feet for more than 15 minutes. And then as a courtesy, we would reach out to those individuals as well to say, hey, you've had contact, and then advise them to quarantine. The evolution of how that position has looked is now that on someone who has that confirmed lab PCR test and saying you're positive, these are what CDC recommends for isolation measures. And people are still fairly receptive of that. We make contact with many of the people that we call. Sometimes we leave a message. If there's no voicemail, a letter is sent to them, but beyond that.
Okay. Oh, go ahead.
Any idea on how many at-home tests are just being tested at home and then followed up on? Because I've been thinking it might be more.
Oh, I'm sure it's more.
Yeah, and Department of Health Services with Wisconsin offers different avenues to get tests, and at-home tests are pretty readily available in the community. We have taken calls from individuals who test positive with at-home tests, just asking for advice or what the guidances are, but we have no way of knowing that or tracking that directly. But our health department is fully staffed.
Car seat. Does that mean people will now come to the health department and not the fire department?
Nope. So we have had car seat well, we call it a car seat fitting or
Okay.
car seat inspection. So our preference would be someone try to install the car seat themselves, and then they come to us and we verify that they did it in a safe way. We've had a car seat technician, Kim Kringle, one of our public health nurses, on staff, so she's been doing that here at the health department.
Okay.
Some fire staff are trained, but people can give us a call during normal business hours and schedule an appointment for
So if they're
that.
from Franklin, you prefer they call the health department? Because I know in the past, they would say call the fire
Yeah, I
department.
believe that they can use the fire department as a resource. I'm not extremely up to date on which staff offer it there,
Right.
but it's nice that our public health staff are here.
And they
from
just
8
set up
to
an
4.
appointment then, and they'll
Yep.
come, okay.
And we do sometimes use their bay, so if it's inclement weather or in winter, just cold, we meet people over there
Sure.
often. But yeah, no, we have 2 staff doing it, which is really
Okay.
What if they're
fantastic.
having problems installing it basically, but don't know how to do it?
Then we help them out. Yeah.
Okay.
Really, it's just the time for mentoring so that they know how to do it, they can feel comfortable, and then we can ensure that it's per the manual. Yeah.
Okay.
Really, it's just the time for mentoring so that they know how to do it, they can feel comfortable, and then we can ensure that it's per the manual guidelines and installed safely into their
The
car.
car seats today are so much easier than the car seats 20
Well,
years
I
ago,
remember
10 years ago.
You had to kneel into it.
Oh my
and
God. Yes, yes, yes.
Do a million gyrations.
Yeah.
That was a lot of years ago for
Yes.
my granddaughter.
Same, yeah.
It sounded like you needed a car seat technician
Yes.
in your life.
I did.
Yeah.
All right.
And then they
But yeah,
those
that's
metal
one of the
tees you would put on
services.
for, it's like,
I went to the fire department over there by the industrial park, and that's where they had it.
Yeah.
You could drive in there, and they,
Great.
they do that now.
okay. Anything else under administrative reports?
I do not.
Then we're going to go right to B, the health department, general updates, and start with communicable diseases.
I do not have any direct updates. Henry and I spoke a little bit prior to starting this meeting officially that it may be nice to bring back to the group official reports on where our numbers are, just so that we can get some trend data over time. So we touched base that we'll talk about general communicable disease at our next meeting.
There's a whole list, like
Yeah.
30, 40 of them, right?
Yeah, that sounds good. And then maybe we'll pull some general trends that we're seeing in our health department, flu follow-up, if we see pertussis on the rise, RSV, it's not a reportable to the health department, but we can talk about general trends that we're seeing. I'm so happy to bring that forward to the group. COVID-19 updates, I kind of gave one already, but we're still seeing COVID-19 in our health department and in our communities. It's still affecting a lot of families, and we're just trying to be a good resource and help people. Prevention measures are pretty much known far and wide by now, and we no longer, which I gave an update at our last meeting, have vaccine. We don't give vaccine in-house anymore just because the demand wasn't there, and individuals can acquire it in other avenues. Typically, but always here for that assurance and resource for people if they're looking for connections. We do the best we can in finding answers.
Do you think COVID-19 will be an annual or shot like flu?
There's still a lot of conversation, and I think still a lot of discovery happening. But we could also maybe pull in Dr. Golden for some advice on that next time. We're ever evolving in our conversations and who's partnering around the table, and we have a public health collaborative in the region, so I'll look to see if any of them have some insight as we move forward.
How about that baby thing that's going on?
RSV.
RSV.
Yeah. Oh,
It's-
shit, anything on that?
It's a
There's no
nasty time for illness right now, and we're seeing a lot of flu and RSV in our community, and that's not unusual for communities to be experiencing that this time of year.
It did
But
start a little bit earlier than it
Flu is
usually
early.
does.
Flu
Than it
is
usually
early.
does.
Flu is
Yeah,
usually after
both were,
Christmas. Christmas
so-
time to March, yeah.
And what about our hospitals? Are they for?
yeah, I
ICU
received
or
a
is it-
report today on a call that they're seeing very large numbers, and it's concerning levels that we have because of the capacities of the hospital, but they're not at maximum capacity. So kind of an ambiguous statement, but it was saying that like
Come and go.
levels are high, but they can still see people. Everyone's really been getting hit hard.
I think one of the problems with hospitals too is you have to put them in an area where it's a contagious disease, so you can't just put them on a regular floor. So some of the floors are empty, but you can't put people with this on those floors. They're either in a special unit or in the emergency room or in intensive care. Intensive care. And there's other people in there, so.
Yeah, and then, so my husband works at Children's, he's on the IT side, but they were currently repurposing conference rooms, offices to be rooms where they'd be able to see children.
Okay.
Because RSV was so high.
Yeah.
So to make sure that all the equipment was in there and everything.
That's at Frater?
No, children.
Children's.
Yep.
Yeah, yep. Human service referrals, we see a lot of these. So a lot of the time we're seeing cases of individuals who live in Franklin who are suffering from hoarding disorders or have hoarded. Quite a few social service referrals in regards to falls. So people who have fallen in their home, can't get up, call the fire department or EMS for lift assist. That's really not what the service is intended for EMS, but they assist anyway, and then refer that to the health department so that we can make connections. With these individuals and see what might be available for them to connect within the county or within our city. Surprisingly high number of individuals are repeat callers or have a repeat situation occurring. So really trying to work with these residents to figure out their best scenario to not overutilize resources intending for something else, and then also get the care that they need. So we've been working a lot with those. We have a lot of open service, social service referrals right now. In regards to dog bites, we have some trickling in now. Summer is by far the busiest time of year for dog bites. So there's been a steady decrease since August. We maybe get 1 or 2 a month now, but still working on the normal protocols with that. Usually our referrals are coming from the police department.
Have you gotten calls on coyotes?
No, actually.
Why do you follow the Franklin community page?
No, we have them in our
All they do
backyard.
is every day someone's commenting about a coyote.
Yeah.
The best, I get calls.
Mm-hmm.
Not
For the
that-
district.
Basically, unless they're threatening, you would call the police. Unless
Okay.
they're threatening your pets or yourself, or they're threatening in a threatening way,
Right.
then you call the police. But other than that, it's the entire population is controlled by the DNR.
Okay.
You cannot shoot them
Yeah.
unless with a bow and arrow, if you are in an area where there is a bow and arrow. But if they are in your yard, I had 6 of them in my yard.
Yes. They go in packs, right?
Yeah, and I looked out in the conservancy and I saw 6 sets of red eyes looking at me. And I was walking my dog. I said, I think it's time we turn around and went home.
Yes.
So the next day they came running up between the houses when I had my dog out, and I yelled at them, and they're afraid of us.
Sure.
So 3 of them ran up the street, and 3 of them ran back into the conservancy. So
Okay.
if you charge them and
What time
yell,
of day?
broad daylight,
Yeah.
they're out in the daylight. And mostly of the time they're night.
Yeah.
There must be food scarcities in some areas because they are patrolling all day long, going
Yes.
back and forth.
We've seen packs go through our backyard.
Yeah.
Yeah.
Yeah, we
So
get a lot
it's-
of calls, but that is not one of them.
It's
surprised.
Looks like you're getting all of them.
DNR is the controlling. You don't call MADIC or anybody, they
Yeah.
can't do it.
Right.
And they're in charge of the wildlife population.
All right, moving on to community health programming.
Yep.
I distributed this handout here, but this is for the Healthy Holidays. Our health department has done this once before, which I believe was in 2019, prior to the COVID-19 pandemic. But the idea around this is to make our programs and offerings accessible for anyone in all different parts of Franklin. So looking to do little pop-ups around the Franklin community at something that is already happening in the community. So whether that's store, going to Forest Park, the library, and offering a few different services that health department staff have available. So you'll see that a few of these have already taken place, but we have some upcoming for the remainder of December. Also, we have our community health assessment in full swing. Recap on where that has been and where it's going. We had done the community key informant interviews, so reaching out to key leaders in Franklin and key community members, individuals across all sectors of Franklin to get their opinions on different health topics. And then from there, we did our opinions on different health topics. And then from there, we did a snowball sample to continuously build this large group of people. And we also did some focus groups with Franklin Public School District staff, some general community members, some City of Franklin staff to get some perspective there. And then we did a randomized sample of a giant community survey. So it was randomized and we sent it out to about 800 people, I believe, and had a really great response to that. So we worked with an epidemiologist to pull all that data, did some analyzing, pulled together a community meeting, and from that we have some key topics that the individuals that were at that meeting chose to work on. So for our community health focus for the next few years for the health department, in partnership with these community members will be focusing on physical activity and nutrition, and then also focusing on mental health with an overarching umbrella of working on community connectedness, thinking that plays a heavy role into some of these other focus areas that we're going to look at. Ellen Henry she is one of the key core members putting this effort forward from the health department perspective, and she's working on organizing the January meeting of community partners. So stay tuned, that invite should be coming out later this week. Some of you were at that meeting or involved in some way. We couldn't have everyone because we don't want to have quorum. It will be coming, and then at that meeting, goals will be set for 2023, and then the introduction of different task forces to work on these topics. So a lot of great things are in the works in that regard, and hopefully we'll have a robust attendance at that meeting.
In terms of the mental health, the mental wellness, is that is that affecting any particular age groups?
That's a good question, and we're going to need to look deeper at data and do different data dives as those task forces. And we'll really have to compile things because there's not even any necessarily any goals to focus right now. But the group that came together all had a chance to analyze all of the data collectively and then identify what they felt was really rising to the top. So that's what this January meeting will be, is to really do a deeper dive and look where that goal needs to focus.
Are you also coordinating this with school administrations and that?
Yeah, there's definitely school representation there. We have some school board members, administration members. Lori O'Neill was involved from the nursing standpoint, and some other teachers as well. But they're going through, from what I've known, and I don't know too much about it, from a discovery process as well for their focuses.
Okay.
So hopefully it'll go hand in hand.
Good.
That's a good question.
Okay, if there's nothing else under Health Department general updates, we'll move into environmental health and emergency.
I actually think I will add one more health department general
Sure.
update that I didn't originally write on the agenda, but that being that we had our immunization program. We do vaccine for children's program through the state, so we are able to offer vaccine for a variety of youth here in Franklin, and we were expecting that result, but it was really exciting to have. So the state came here and did our site visit with myself, and then one of our public health nurses, Amy Kremsky, took the lead on that, and she's been working that program a lot since Lori has retired.
Right.
So she took that over, and I'm really proud of them. So we're operating a really fabulous mention that we're in 100% compliance.
What's going on
What
with?
does that mean?
It means
100%
that
compliance.
every single thing that we're doing in regards to that program is meeting the standard that the state put forward. So from us storing the vaccine to how we're ordering the vaccine to administering it, our policies and procedures that we have in place, all different components of the program.
Good.
Is in compliance.
What's going on with the flu clinics then?
Yeah, we're done with our flu clinics.
Completely?
Yes, and
Okay.
they were phenomenally attended, so there was high demand, looking to order potentially more flu vaccine than we did this year. Finally analyzing the different trend data from the past 5-ish years and seeing what we want our ordering numbers to be, but it was a really great turnout. So flu clinics went
How
fabulously.
many clinics were there?
There was the one large one that's at the senior health fair, and I think 5 supplemental ones, but I would
wow.
have to confirm that.
Awesome.
All right, now we can move on.
Okay, then to environmental health.
All right, my only update in regards to environmental health is that we have a very part-time sanitarian, Jamie, who works 0.1 FTEs. Bill brought her on
Right.
to help with our demands on our DATCAP state agent program in environmental health. Over the past 2 months, we were authorized to increase her hours to just help essentially catch up for where we've been because of COVID response. So with everything being closed, we weren't able to do an annual license, and we're trying to get all those in. And then also we have had a large increase in development across Franklin. So being able to go to the retail food establishments and a lot of temporary and mobile licenses with food trucks have taken our time up. So it's really great that we have Jamie on board, and we've been able to allocate some more. Hours to her.
Didn't we have somebody coming from Oak Creek or Greenfield to help out?
That's a good question, and that might have been long ago,
Okay.
but not that I know of in the recent future from Oak Creek or
They're
Greenfield.
utilizing their sanitation.
Yeah, long
Offset.
ago, Angie Byer, who is our sanitarian full-time, did work in a different department and offered aid when Bill
Okay.
was here.
Okay.
Now we're lucky to have a full-time sanitarian, but it's really an ever-growing need, and I forecast it will only be increasing for
Sure.
what we need here.
And the food trucks, aren't they inspected at their base station?
Yeah, interesting that you say that. So if a food truck comes to a city-sponsored event, we need to inspect them.
Okay.
And also, it depends on what licensing year they fall in. So Jamie and Angie are the experts on this. Miss Allie as well, our administrative assistant. But we have to frequently go out there. So with the holiday festival that Franklin just had, they had some food trucks, so we were able to inspect them. And the thought is that, well, being in compliance with the state agent program, but also ensuring that they're meeting the safety requirements locally. So as these food truck events continue to grow, the demand just continues to grow with them.
But they're not licensed through Franklin.
Some are,
They can.
yeah.
Well, they
some-
can be,
yeah,
right,
mhm,
right.
Some are, and then we have them come from all over.
Right.
So, yeah, it's
Do they have to pay for a permit then, or?
they pay for their life in
Do,
Franklin.
there is an inspection fee,
Mm-hmm.
okay, okay.
Yeah. So if we go out there, yes.
Like if we could get 2 or 3 different community or licenses from different communities coming to the ballpark.
Right,
But yet we would have to do the on-site inspection of them to make sure that they're
okay.
in,
It's kind of like a festival,
right,
okay.
and,
It's kind of like a festival,
right.
okay.
To ensure compliance, yeah.
But they can be licensed from any city, probably in the county and still.
Yeah, they need to have an active license, which they could get from us. Like, we could work with them to do that.
Right.
But then the inspection fee, yes.
I know a lot of these places have several trucks of bait somewhere in Milwaukee, and they just go out to Oak Creek, to Franklin, to, you know, all over, and they would get their license through Milwaukee.
Yeah, and a taxing part of the programs as well is the administrative load of that all. So keeping track of everyone that's coming in and ensuring that we have their license in advance, and then that track of everyone that's coming in and ensuring that we have their license in advance, and then that we're able to schedule with ample time to get out there and inspect them.
Do they have to call you to say they're going to be setting up, or?
Yeah, typically so I'll use the Ballpark Commons
Yeah.
for example, is when food trucks come there, they have an on-site organizer. So in theory, they would all provide their information to this individual, they would check their license, they would submit that to us with 48 hours advance notice, and then we would ensure that they have an active license, and then we could plan for their day of inspection.
Okay, because I see like on Loomis and Layton, there's a food truck that, you know, right on Loomis Road. Could a food truck just open up on 76, you know,
Yeah, that is questions that they need to talk to the zoning department about and our department specifically. But it would need to meet different, a variety.
And it's like, oh, I didn't know I needed to do that.
Theoretically, yes.
Who would
but-
stop, would the police then see them and ask for a license?
Well,
or-
residents could let health department, zoning, city know.
Okay.
And not to say that people don't have their license or checked with proper channels, but typically that would be working with the
Somebody-
channels, but typically that would be working with the
Somebody
health
would check them
department.
out. Okay.
Yep. All right. So that is all I have in that regard. Let me just verify my notes. Okay, one other thing that I did want to mention, and I briefly had made mention, we want to ensure that we all are able to meet in 2023. So I did send a reminder of all the meeting dates that we'll be able to come together. I don't know if it's easier if we were to say, let's plan on one a quarter and set that date in our minds. So we're maybe only planning on meeting 5 times in the year, or it's just easier to plan on 8, and then if it doesn't work out, it doesn't work out. And we can kind of see, I'll let you guys think on that, but I'll send a follow-up email to this meeting because I'd also like to do a discovery survey to hear about what you guys are looking to contribute as Board of Health members. I think it would be fun to learn a little bit more about you, but then also your level of interest and involvement in regards to policy work, goal setting, involvement with hands-on things like that.
Does our charter specifically say how many times we have to meet a year?
Once a
Yep.
quarter, 4 times a year.
That's the,
Well, we did not meet in the third quarter, but we met more than 4 times this year.
Yeah.
And that's because we met, but we didn't have a quorum. Somebody was sick, somebody was out of town, it just ended up that there were twice that we actually got together and we didn't have enough for a quorum, so we had to dismiss.
And I would love to make it worthwhile, some action-based and fruitful discussion at our meetings, not just things that I could give you in an email. So we can we'll plan on having the first few at least of 2023, just until we fully just identify what we want our structure to be. But then we can kind of see where it goes.
Plus, we're hired down 2 members.
Yes.
And that makes a big, 2 voting members, right?
Yes. So a
Lori
nice
and,
balance
Peggy.
of how to utilize everyone's time.
Now, do you
And then
anticipate
also
Lori
ensure-
coming back?
I'll have to
Reach out.
reroute to her, but she, as of right now, no. I
Okay,
would
Peggy,
see.
we need to, yes, okay.
Yes. Dr. Golden has a few individuals that she may be advising that they can apply,
Okay.
but certainly, and Amy, you had maybe potentially a few ideas as well.
Yeah, I
So
did.
we can all
So
touch
anybody that
base
may
on
know
that.
somebody interested, yeah, please let Laura know. Please let Laura know.
And I did reach out to those folks. It's just kind of a busy time.
Yeah,
Yeah.
So
Oh.
the new year hopefully will.
Yeah.
that sounds fabulous.
anybody on volition like that?
That's a good question. We'll have to route that question over to Volition. I'm not sure of their current roster in regards to those, but definitely something to look into.
But in the past, not everybody was in the health field, actually.
Yeah, the state statute right now is to make a good faith effort to have a physician, if
Yeah.
not a.
Oh, yeah, yeah.
Yeah, because she's a PT.
Yeah.
Sorry, I can't
Yes, kids
think
in
of
the
it right
community.
now. An assistant.
Okay.
And then if individuals in those 2 fields are not
Talk more about it.
able or interested, then we can continue to explore options,
Right,
which we will do.
right. Is there anything else? Hearing none, I need a motion to adjourn.
Aye.
Aye.
I wish everybody a very happy holiday.